The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Duello. Dr. Duello, welcome to the program.
Hi, Randy. Nice to be here.
Now, before we get into today's topic, tell me a little bit about your practice. What type of patients do you see? Who's your typical patient, I should say?
Well, we have a lot of patients from all walks of life. We have young people, we have people middle-aged who are facing losing teeth for whatever reason, genetics or disease. And we have older adults who've had their teeth for a long time and are missing maybe one tooth or maybe two or three, or unfortunately have lost all their teeth and now looking for some solution to help them.
Now, the denture wearers, you say, are now coming forward. No more dentures. Is that real? Is that what's happening?
Well, I think it's definitely real. When Dr. Brandemark, who actually started doing implants almost 50 years ago, had a statement. He said, no patient should die with their teeth in a jar.
Interesting.
Yeah, I really believe that. And it really affects people's lives, especially when they get older and they want to travel and they want to do things and they don't want to be burdened by social discomfort. Let's say they're on a cruise and their teeth fall out. That's no fun. You're supposed to enjoy your life. So we now have the ability so people don't have to worry about their teeth when they retire.
Now, you told me something in the green room. You said, I don't want to say it the wrong way, but something about you never have a patient that doesn't say, I shouldn't have done this earlier. Is that right?
No. Every patient that I've ever done implants who's worn dentures has said the following statement. If I would have known it was going to be this good, I would have done it sooner. They always say that.
And what defines good? That means because they eat or they thought it was going to be painful or what? I mean, what?
Well, for every person it's different. For some people it's eating. They say they want to eat an apple. They say salad. That was the thing that surprised me the most was salad. They can't feel salad when they have dentures.
Oh, really?
No, they can't chew it, and they say they bite into salad and it doesn't tear. So for people who like salads, and that's a good food for health, they can eat that when they get dental implants. For some people, it's social embarrassment. They are afraid to go to parties or they're afraid to be in a social environment.
Do they tell you this on the consult? I mean, when you're meeting with them, they say this stuff?
They don't tell you the first time, but eventually, once you get to know the patient and their individual needs, they'll secretly tell you that, now that I have the implants, let me tell you, Dr. Duello, the story. I was afraid to go with my girlfriends and go out to dinner because I was afraid that my teeth would come out or I couldn't eat the foods that they were eating. But now they tell me they don't have those problems. So it's kind of like they go through this metamorphosis like a butterfly who's in this little cocoon and they're held up socially. But then you do the implants and their life changes. And that's why our office, we say, change your smile, change your life.
And you're a specialist. Does it cost more to go to a specialist?
Oh, I don't think so. I think that's a perception that some people might have, but in reality, we do the same things that other dentists do, other general dentists do the same thing we do. So whether it's this or that's only for the patient to value as to what's the best part.
So as a periodontist, exactly what is the training as a periodontist? Summing it up.
Well, most training is occurring in a dental school. After dental school, it takes 3 years, and in some cases you get a special degree associated with
Mostly surgical training?
Surgical, diagnostic, looking at different options for patients that you wouldn't be necessarily be trained for in dental school.
So getting right into it then, so who is the typical dental implant patient?
I would say the typical dental implant patient is somebody who's probably lost all of their teeth. That's where I started doing dental implants because those are the people, in my opinion, that suffer the most with inability to chew. They don't like how they feel. They can't taste their food. They can't feel the hot or cold of a food or the taste of a food because the denture's covering up the area where you taste your food. We'll see them because they've had 3 or 4 dentures made from different dentists who are very good. Most dentists do a good job of making dentures, but it's not the dentist, it's actually the fact that it's a denture and it moves.
So why do they the dentures wear out?
The dentures wear out, but more importantly, the bone underneath the denture changes, and that's part of the aging process that occurs with dentures. And what the patient doesn't see in their mouth, they see in their face. Because what happens to their face prematurely ages, even though the patient is getting older.
Why? Because they're losing bone?
Because they're losing bone.
Interesting, okay.
Yeah, so that's a pretty typical patient. on the other end of the spectrum, we'll see young patients who have unfortunately been born without a tooth, yesterday I saw a young man who was in a traumatic injury associated with a fall and lost a front tooth, which is very traumatic for a young person that, let's say, just came out of braces. Their parents, took good care of them. They've been brushing. And
then he loses the tooth.
And he loses the front tooth. And that can affect a patient quite a bit.
So starting then, like the person that is just missing one tooth, okay? What are the clear advantages of a dental implant over traditional dentistry?
Well, in this particular young man's case that came to me yesterday, he was wearing a removable appliance, and he is a theater major at the university, and he said every time he'd be in this play, this tooth would be moving back and forth, and he became very self-conscious about it himself. Although the audience didn't know it was going on, he felt that they could see this tooth going back and forth, and he said, if I'm going to be a real actor, I got to have a real tooth. And one of the ways we could give him a real tooth was to do a dental implant. You can do it with a bridge, but unfortunately a bridge involves, maybe in this gentleman's case, cutting down two perfectly good teeth on either side. And he even stated to me that he had a friend who had a bridge, and he said he wasn't happy with it. And so because he wasn't happy with it, he said,
Could you match it up? I mean, a front tooth with a dental implant? I mean, where it just blends in? I guess that's...
Yeah, that's the idea, is it's an artificial replacement for the tooth. And today with the technology, with white crowns and all the cosmetic dentistry that the general dentist can do, they can really make it look perfect almost. And he even said it looks perfect, it feels perfect. And he even remarked he doesn't put his tongue up against it anymore and flip it back and forth, because now it's solid and he's really back. It took him a while, but now he said it's perfect. It's like a natural tooth.
Okay. Now, so I asked you about categories of patients. Okay, so the denture wear, missing one or two teeth. What else?
I think the patient that's faced with the biggest challenge is the person who's about ready to lose their teeth. They have some significant dental diseases that their dentist has told them about, and they're at a crossroads dentally.
So like what? Dentures, dental implants?
Dentures, dental implants, partials. They've had the bridges, they've had partials in the past, and now, for whatever reason, the number of teeth that are left aren't satisfactory to place conventional dentistry on. So that patient's really confused as to what to do. And so the dentist in this case counsels them, and I think most dentists today feel that dental implants are probably the best solution for these patients to avoid the problems that we already stated that the patients that have dentures have. And so if we have an opportunity to talk with these patients before they lose their teeth, we really can never allow them to suffer. And I see people who suffer all the time, and it's because either they weren't told or...
What do you mean they suffer?
They suffer because losing your teeth is losing part of your life.
Okay.
And as I said in our opening, change your smile, change your life. It's not about the smile necessarily, but people identify us with our teeth as they do with hair, and people identify me with no hair. But I think that if you take out one tooth, it's been shown that people who are quite glamorous and beautiful, if they lose one tooth, they don't have that star power that they have.
That's right. Okay, that's a good point.
And I think that when you lose all of your teeth, some people feel like, well, this is the first sign of me aging. This is the first sign of, the golden years, so to speak, coming on. And today people don't want to do that. Our society, everybody's active, and they don't want to be suffering with having the loss of their teeth. So we have the option today to replace their teeth. My grandfather didn't. He used to give people dentures, and he said he'd watch them from the window.
Your grandfather was a dentist?
My grandfather was a dentist.
Okay.
And he said he'd watch people from the window go out into their car, and he could tell whether or not they were going to be able to wear the dentures or not. And he said in his era, if they didn't wear the dentures, they didn't come back. They just put the dentures in a drawer, and they went around looking like an old person for the rest of their life. And we don't have to do that today. Today we can help people. We can really give them back their smile. And it's not changing their life, it's keeping their life.
Interesting.
That's what I'm trying to do. As a periodontist, we try to prevent disease. And what dental implants do is prevent chewing problems, prevent aging, prevent those social situations from coming up. And that's why those patients who are now faced with losing their teeth, I want to get to them now.
How old can you be to get dental implants? I say that because my mother, and I think I've told you this before, 74 years old, and she says, Randy, I'm too old. My medical doctor said they'll fall out. But you say that's just not the case.
Really, Randy, there's two criteria. One, do you have enough bone for the implant to be stable? And two, are you medically healthy enough to have a surgical procedure? And in our practice, we do the surgery.
Like, what are the old, the upper end of ages that you're doing this with?
I have done implants in patients in their 90s.
90s?
Yes, and I think I've mentioned this to you. I had a patient who told me that her goal in life was to die with her teeth in her head.
Okay.
And,
you didn't tell me this, by the way.
I didn't, but
Interesting.
Yeah, she really suffered for most of her life without teeth, and her husband passed away and left her very well off. And she said that I'm going to take the money that my husband left for me, and I'm going to take care of myself. So my goal is to go to my grave with teeth that I can chew with, and they're not going to take them out when they bury me. And
So you did tell me that story.
Yeah, that sounds rather morbid, but it just shows here's a person at the latter part of the stages of their life, and their teeth were that important to them. And we see that all the time, that whether it's one tooth or two teeth or a whole set of teeth, these people are in a situation that if you don't really know them very well, they don't tell you. But once you get to know these patients and then they get the result, like I said, everybody I've ever done it on says, if I'd have known it was going to be this good, I'd have done it sooner. I wish they'd tell me that at the start, but you have to go through the process with them, whether it's, doing the surgery in one day, which...
Is that true, though? I mean look, in a perfect situation, okay, ideal situation, somebody watching this denture wear goes in and they can walk out in a few appointments with a fixed set of teeth.
Absolutely.
Is that right?
Absolutely.
So what's changed? I mean, why is it, and I've done some research, why is it that what used to take 9 months or a year now can happen in, a visit or two?
Well, we learned.
I mean, what's changed?
We learned some things, because this really wasn't driven by the science. It was driven by patients asking us to do that. Because patients heard, well, if you have dental implants, it's going to take this long, and it's going to hurt, and this and that. And so people didn't do it. I can't blame them. Who wants to do anything?
And bone grafts from the hip?
Sure. Well, yeah.
Is that almost behind you?
That's
like
completely
rare?
It's rare. It's rare today that we have to do those. Those are very special circumstances. But today, the patient who's faced with losing their teeth, it's routine that if the opportunity is there, we can take out the teeth, put implants in, give them some kind of prosthesis.
And the bone just grabs onto that implant.
The bone grabs onto,
right?
Yeah,
Okay.
Absolutely. And we didn't believe that 30 years ago, but now all the studies show, and what we teach in the courses that we give, that's our preferred method that we teach the students, if it's possible.
I had an oncologist on this show, and he said, I have one dental implant, Randy. And I said, really? Because I've interviewed some dentists about it and knew you were coming on the show. And he says, it's going to take about 9 months, and then I'm going to get the tooth. And this is a young guy. The guy can't be more than 50 years old. I said, I think that's old technology. 9 months waiting? What are your thoughts on that? I mean, does that still happen today? Where not everybody's up to speed, I guess?
It does happen in some cases, because usually it's because the patient waited too long to address the problem.
But he's a healthy guy.
Yeah, but unfortunately, sometimes the tooth will crack or break, and there'll be disease that we can't see that's obvious.
Okay.
So it does happen, but it's more common. The more common situation is somebody broke a tooth.
Now, you say that putting a CT scan in your office, which is rare, you say, has changed everything. How so? I mean, better outcomes for patients.
It's changed everything for the patient, because today we can look at the bone, make a quick diagnosis. We have software that actually lets me do the surgery on the software before I ever do it in the patient to determine if it's going to be safe.
Okay.
And I think if I was a patient, I'd want to know that. I don't want a surgeon to say, well, I'd like to open you up and look and see if I can do it.
When you're training other dentists, because for people just tuning in, you lecture to dentists throughout the United States, teaching them how to do dental implants. Do you tell them, hey, you've got to get a CT scan in your practice?
I tell them it's not necessary in all cases for you to have one. I would like you to have one.
Okay.
And you can rent one.
Makes it easier for you, though, right?
Makes it easier and more convenient for the patient if we can do it right there. Of course it does. Okay. And patients don't like to be shuffled around. That's one of the things they complain about in healthcare, is getting shuffled around. So we don't do that, because we have the technology in our office, which allows us to do the surgery quicker, safer, and most importantly, predictable.
What about pain? I mean, it seems painful. That's got to be one of the things that holds people back.
Well, sure, it would hold me back.
Yeah.
Nobody wants to have pain. But the reality is the procedure is done in a very gentle manner. Number two, we make sure that the patient is adequately treated to relieve any discomfort or anxiety, so we have the ability to make people relaxed when we do it. Most people just take an Advil or a Tylenol.
Is that right?
Yeah, surprisingly. Now,
So the next day you could just take...
Yeah. And everybody's an individual, how they respond to some kind of treatment. So we want to understand the patient, understand their needs and trepidations so that we can take care of those things. But the reality is most patients do very well with this procedure.
Okay, now, in St. Louis, there's got to be what? I went on the internet, there's about 20 million to 45 million Americans that have an upper lower denture. So in St. Louis, it's got to have 500,000 people wearing dentures. If it's as good as you say it is, why isn't everybody doing it? Why aren't these denture wearers coming in and doing it?
Well, unfortunately, I think a lot of denture wearers are not in a dentist office. So they've had their dentures for about 10 years, and now they're getting old. The dentures themselves are getting old. Their bone has changed.
So nobody's suggesting they do it? Is that what you're implying?
No, nobody's suggesting, nor do they have a dentist. They don't realize that they could be helped. Okay. So that's a patient. And then there are dentists who have patients in their practice who don't have teeth, and I know those dentists. They're very good dentists, and they're very ethical dentists, and they're trying to encourage their patients to get these problems taken care of. But they're not being able to motivate them. So we hope that...
So they just don't know?
They just don't know.
Now, is it true, 2 dental implants, and we're going to take a break in a minute, that 2 dental implants could give somebody something that's really secure in their mouth for the denture wearer?
Absolutely.
Tell me about that.
It's interesting. You wouldn't think that you could replace 18 teeth with 2 implants and get somebody to be as happy as those patients are. And all the studies show that the patients do well. My own experience is I'm actually shocked how well these people do with just 2 implants. And the good news is that's where they can start. And if they want more in the future, we can do more, whatever.
So 2 dental implants gives them something like a full set of teeth that snap in and snap out.
Absolutely.
Some adhesive or no adhesive?
That's the beauty. No adhesive. And one of the things that people would love to get rid of is those adhesives because they don't taste good, they're gooey, they're messy, and when the implants attach to the denture, there's no need for those anymore. So it's a great benefit for the patient.
All right, we're going to take a quick break. Also, I have a lot of questions about the process and the other options for denture wearers. You're watching The Wellness Hour, the leader in medical news and information. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. And with us, we have an expert on the topic, Dr. Duello, board-certified periodontist. Okay, now, and people don't need a referral to see a specialist like you. Is that right? They could go directly to you. They could talk to their general dentist, which you recommend?
Yes, we generally recommend that people talk with their dentist because they have familiarity with them and they're comfortable with their understanding of their problem, but also people can come to us directly, either through family or personal friends that we've treated, and we're happy to see them.
And people don't have to leave their current dentist, right? I mean, you work together with the general dentist. Is that right?
Yeah,
is that how it works?
In most cases, we encourage that because they have a relationship. So we want to maintain that relationship with the dentist and the patient, and we work together as a team to help everybody get the best results possible.
Okay, teeth in a day. So denture wearers could go in, and these terms like teeth in a day is possible. Is that right?
It's absolutely possible. And for people who have already lost their teeth or people who are going to lose maybe a few teeth and then have no teeth, that's probably the best option for them. And that's what we look for to help those patients not have loose teeth, loose dentures, the social situations. That's the best.
Now, do you think people count their teeth and think, oh my goodness, I need a bunch of dental implants? And you say only 2 implants.
Well, there's a couple misconceptions.
Okay.
The first is that you have to have an implant for every tooth that's lost, and that's not true. We only probably need to put 4 to 6 implants in the lower to replace the lower teeth, and similar on the upper, 4 to 6 implants to replace the missing upper teeth.
How many do you need on, let's say, a 75-year-old healthy person to give them something fixed, something that doesn't come in and out, like a fixed, complete set of teeth?
It's probably 4 to 6, Randy, but to be honest with you, I don't really focus on the numbers of implants. What I focus more on is what is your problem and what solution do you want to meet your problem? Because if they want teeth that act like teeth, walk like teeth, chew like teeth, smile like teeth, that's a different situation.
And what is that? Then what's good for them?
Yeah, what's good for them is probably to put more implants in to make sure that everything is going to be fixed for a long period of time. The reality is somebody in their 70s probably has a life expectancy of another 20 years. So we need something that's going to hold up for 20 years.
Isn't that what everybody wants, though? Teeth that don't come in and out, right? I mean, that seems like that's what everybody wants.
My experience is those patients have the best results and the greatest personal satisfaction from the procedures that we do. So I would say yes. But It also is true that some people are very satisfied with dentures that are removable still. For some reason, that they tell me, I still like to scrub them. And so they want implants, but they want to be able to scrub their denture. So
snap in, snap out.
Snap out. So that's an acceptable solution for those patients. And they feel that they can chew adequately, but more importantly, that the implants are preventing the premature loss of the face, helping chewing, and giving them that self-confidence. So it's not necessarily whether I think fixed is better or removable is better, it's what's the right situation for you is what my concern is.
Okay, now, we've talked quite a bit about this, and I said, I want you to come on the program to talk about dental implants. And I like what you said, because you say that it's more than just dental implants. It's about having a smile that you're proud of, being able to eat. Elaborate on that.
Well, I think it's important that patients understand what teeth do. First of all, one of the reasons that we want